When I start my day at the gym, which for me is not only taking care of my physical health, but my mental health, because it allows me to release a lot of the energy that I have and put a lot of focus into something that's very positive. And then being a teacher, mental health is just something that I really strive to push for in my classroom. I want the students to learn that mental health is just important as their physical health. In my classroom, I have a space for students to go if they're feeling big emotions like sad or angry or frustrated, and we call it our calming corner. And so the calming corner is essentially just a carpeted area, has a big beanbag chair, and it's in front of a window, and it has different fidgets and things like that are meant to calm the body. And so at the beginning of the year, we talk about the different emotions they can feel, and really we're looking at more of the main emotions. Obviously there's lots of other emotions, but we're looking at kind of anger and frustration and sadness and happiness. And so it's just being aware of when we feel those feelings, what are some things we can do? And so the calming corner has a bunch of strategies like squishing putty, or maybe they need something to fidget with. And we have weighted blankets as well to help them ground, because then they feel the pressure. And a lot of our students really need that sensory kind of that hug that you get from a weighted blanket, especially our students with autism. That's a really big thing for them. And then we also have noise canceling headphones, which helps as well because it kind of quiets them down. I have a lot of students who will come in the morning and they'll be very upset. And the first thing they'll say to me is, Miss I, I'm not feeling great today. Can I go to the calming corner? A 5-year-old saying that, I've done my job. I'm happy you've graduated, go to grade 1. Because really that skill alone will take them so far. Further than them knowing, great, fine. If they know their numbers, I'm happy. But if they can tell me how they're feeling and what they need to do, well, I've done my job. It makes me so happy. And then we do take time near the end of every day to do some mindfulness. And really at this age, I'm just looking for them to recognize what it feels like when their body's calm. So we do get them to lie down, we get them to close their eyes, we put on some calming music, and sometimes I'll do visualization with them, which means that I'm essentially telling them a story so that they can picture it in their heads, and then I take them through some deep breathing. But most of the time I'm just looking for, can they rest their body and do they recognize what that looks like? A lot of the kids, when they're resting, their shoulders are up by their ears, they look like adults when we're trying to rest, right? Our shoulders are up by our ears, our eyes are kind of closed, but they're not really, and we're kind of wiggling in our seat. And so it's just getting them to recognize that when we're resting, it's when our body's fully relaxed, we kind of melt into the ground, and it's almost that minute before we fall asleep, and that's how we should feel. And so oftentimes we're getting kids to kind of recognize that feeling, and if that's pushing on down, using a weighted blanket so that they recognize how it feels to kind of melt into the ground, and getting them to take those deep breaths to recognize how they can get their body to relax.